Hi, I'm Tonia Caruso. Welcome to Comcast Newsmakers, giving infants throughout our region a chance to thrive. Joining us in our studios this half hour is Roslynne Wilson. She's a board member for Healthy Start Incorporated. Thank you so much for coming in and talking with us today.
Thank you for giving us the opportunity.
Healthy Start, so important, and tell me a little bit about the organization.
Well, Healthy Start services families in Allegheny, Fayette, and parts of Westmoreland County, and it serves pregnant mothers, and it also services parents that have children up to the age of 2 years old.
And what do we know right now about the situation and where we are statistic-wise about the health of infants and young toddlers?
Well, Healthy Start was started in 1991 with 15 projects, and the goal was to have community-based consortiums led by community leaders to reduce infant mortality by 50%. Our target audience was African Americans because infant mortality among them was 2.5% higher than whites, with only 20% of the births. So our focus certainly has been on reducing infant mortality in our children.
And so where do we stand now? Are we making strides? Is there still a lot more work to be done? How are things today?
Well, despite many of our efforts, we still know that it's a problem, but we feel that at Healthy Start we have made a lot of strides through our innovative strategies.
Yeah, and as we continue to talk, we're putting on the screen website and phone number where folks can go for more information. You offer a number of different programs.
We do. We offer programming for fathers also, which is a great thing because they're certainly a part of the family nucleus. We've had 2 projects with our fathers. One was called the Male Initiative Project, and because we were so successful in 2006, the federal government also funded us for a new project called Promoting Healthy Fathers and Healthy Marriage Initiative.
And why do you feel, or why are studies showing, research showing that that is so important?
Well, we know that it's important to have a family nucleus, and it's important for the fathers to be a part of the family, and they also need education as to what they need to do to bring up healthy children.
Right. So who is eligible for your services? Someone watching at home, if they pick up the phone and call, what sort of process do they go through?
They come and they call, and we have an intake worker, and they'll take down information. If a woman is pregnant, or if they have children up to the age of 2, they can certainly utilize our services, which are all free. Our services entail educating the families about good health care. They also have counseling, we do screenings, and we also refer our families for specialized health care needs. Some of the projects are done in the home or in the community, which makes it very convenient for our consumers.
Right, and how important is it to raise awareness to this issue? And September is an important month for you all.
You're right. September is National Infant Mortality Awareness Month, and it's very important because I think a lot of people in the community don't know the services that are out there for free for them to make sure that we are bringing up healthy children.
Right, and when it comes to mothers who are pregnant, how important is the preparation, the prenatal care to having a healthy baby?
It is very important, and I think oftentimes, especially young mothers, really don't know where to start. And we have all of the services. We have nurses that go out into the community and provide support and education so that they know the latest things and what they should be doing with their children.
Yeah, and what would you describe would be the ultimate goal of Healthy Start?
Well, our ultimate goal is not to have any of our infants die, but we know that that's not realistic. But we feel the more that we are able to educate our community and our mothers, we feel that we will reduce infant mortality.
Yeah, and what is that like for you as a board member when you see the work that you all are doing and staff is doing and the difference that it's making?
We have a wonderful staff, and it is so gratifying to see all of the work and the tireless hours that they give to the community. So it is very rewarding.
Well, Roslynne, we thank you so much for coming in and talking with us today. We certainly do appreciate it.
Well, we really appreciate having the opportunity to share the good news.
Yeah, well, thank you so much. I'm Tonia Caruso. Thanks for watching Comcast Newsmakers. We'll send you back now to HLN.